Hello and welcome. Have you ever woken up with a painful, red bump on your eyelid? Chances are you've encountered a hordeolum, more commonly known as a stye. In this video, we'll delve into what a stye is, what causes it, how it's treated, and ways to prevent it from recurring. So, what exactly causes a stye? A stye is usually caused by a bacterial infection, most commonly Staphylococcus aureus. This bacteria often lives harmlessly on our skin, but it can sometimes enter the oil glands or hair follicles of the eyelid, leading to infection and inflammation. Let's break down the process of how a stye develops. When bacteria invade the eyelid's oil glands or hair follicles, they trigger an inflammatory response. This leads to the formation of a localized abscess, which is essentially a pocket of pus surrounded by inflamed tissue. The swelling, redness, and pain are all results of this inflammatory process. It's your body's natural defense mechanism kicking in to fight off the infection. Styes are a very common condition, affecting people of all ages and backgrounds. While specific statistics on the exact prevalence of styes are limited, it's safe to say that most individuals will experience a stye at least once in their lifetime. There are no specific demographic groups that are significantly more prone to styes, but certain factors like poor hygiene, underlying skin conditions, and eye makeup habits can increase the risk. The signs and symptoms of a stye are usually quite noticeable. The most common symptom is a painful, red bump along the edge of your eyelid. You might also experience swelling, tenderness to the touch, a gritty sensation in the eye, increased tearing, and sensitivity to light. In some cases, a small yellow spot, which is the pus-filled center, may be visible at the tip of the stye. Diagnosing a stye is typically straightforward and can be done through a simple visual examination by a doctor or eye care professional. Based on the appearance and symptoms, a diagnosis can usually be made without any special tests. Your doctor may ask about your medical history and hygiene habits to rule out any underlying conditions that could be contributing to the stye. Styes can be classified into two main types based on their location. External hordeola, which are the most common type, occur along the outer edge of the eyelid. They usually develop from an infection of an eyelash follicle or nearby oil gland. Internal hordeola, on the other hand, occur inside the eyelid. They are typically caused by an infection of the meibomian glands, which produce an oily substance that helps lubricate the eye. Fortunately, most styes resolve on their own within a week or two with simple home care. Applying warm compresses for 10-15 minutes, several times a day, can help to encourage drainage and reduce inflammation. It's important to avoid squeezing or popping the stye, as this can spread the infection. If the stye doesn't improve with home care, or if the infection spreads, your doctor may prescribe topical antibiotic ointment. In rare cases, if the stye is very large or persistent, it may need to be drained surgically. Prevention is key when it comes to styes. Maintaining good hygiene is essential. Wash your hands frequently, especially before touching your eyes. Avoid rubbing your eyes, as this can introduce bacteria. If you wear contact lenses, be sure to clean and disinfect them properly. For women, it's important to remove eye makeup completely before bed and to replace eye makeup regularly to prevent bacterial contamination. The prognosis for a stye is generally excellent. Most styes resolve completely without any long-term complications. Recent research has focused on understanding the role of the microbiome in eyelid health and how disruptions in the microbiome may contribute to development of styes. Additionally, studies are exploring new approaches to treating styes, such as novel antimicrobial agents and targeted therapies. Thank you for watching, and we hope this video has provided you with a better understanding of styes.